Hello everyone, this is Kristen Maka with Futurity First Insurance Group. I hope you're having a great week. Welcome to Kristen's Nuggets of Knowledge. Last week's Nuggets was on the Medicare Advantage plans, how they came about, and why a lot of them can charge a very, very low or $0 premium. This week we're going to go into the basics on how they work, how they're designed, and how you pay within these particular plans. So, shall we go grab this week's Nuggets of Knowledge? Yes, we shall. Come on. Since Medicare Advantage plans are provided by private insurance companies, they work very similar to the way that maybe your employer had their employer-sponsored insurance plan. It's kind of a pay-as-you-go type of plan. You have a co-insurance or a co-payment for every different service, as well as there may be a deductible. And then there is also, with every single Medicare Advantage plan, there is a maximum out-of-pocket for the year. Now, CMS regulates. They don't standardize the plan. So one of the ways that they regulate it is they regulate this maximum out-of-pocket for the year. They break it into two different categories because a lot of these Medicare Advantage plans have costs associated with in-network doctors versus out-of-network doctors. So when we're talking the CMS guidelines on their maximum out-of-pocket for in-network doctors for plans, we're looking at $6,700. And when we're looking at out-of-network doctors, we're looking at $10,000. Now I know that seems like a lot of money, but trust me, if you're in a very large city that has a good number of people on a plan, because these plans cannot have so much profit inside them. Anytime that the profit inside the plan gets to be too much, CMS tells them that they have to put the profit back into the plan. So every year these plans just become more robust and better. The ancillary benefits get better for the individuals. So I'm telling you right now, there's a lot of plans out there that have way lower maximum out-of-pockets than those numbers I just tossed out at you. Another thing to take note of is because these are not standardized, every single company can have a different cost structure. And even within that same company, like every single state, every single county can have a totally different pricing structure. And the way that you find that information out is you go look at what is called the evidence of coverage. Within the evidence of coverage, it shows you exactly, it's going to be a big, thick packet. And it's going to show you every single service that they provide along with every single pricing structure that is within that plan. And from there, you can see if it is even worth your time to look at one of these Medicare Advantage plans. Now, as I said, CMS regulates that they have to, at minimum, cover everything that original Medicare covers. But a lot of these plans are getting so robust that the ancillary benefits inside them, so the extra benefits there, they can be dental, vision, hearing, gym memberships, food cards, you name it. There's a whole bunch of extra benefits out there. And that's why a lot of these plans are very popular, is because they have all these ancillary benefits. So you don't have to have 5 or 6 different insurance cards. You can have one card for everything. Along with these ancillary benefits, these plans can also include a prescription drug plan. So that is when you're looking at an MAPD, that is Medicare Advantage with prescription drug coverage. And in that, you do have your plan, and then you have your health side of the plan. So all your co-insurance, co-pays, everything, maximum out of pocket that's associated with the health side. And then you also have co-pays, co-insurance, maximum out of pocket that's included with your prescription drug side. Now, the prescription drug plans that are included within these MAPD plans work exactly like how standalone PDP plans work. So if you want to know information about that, I do have videos out there for the prescription side of things. So go check those videos out. But let's look at an example of what the copays might be inside your Medicare Advantage plan. So say your joints are hurting. So you go see your primary care physician, and he says that, I can't handle that. You're going to go see Dr. Lulu, and she's a rheumatologist. So you see Dr. Lulu, and she says, we need blood work, we need the labs from that blood work, and then you need to come back and check out the results. And then you check out the results and she prescribes you drugs. So there are 6 different things here that is going to be covered by your MAPD. And they're all going to be billed separately. We have the first 5 items which have to do with the medical side of things. So most times your primary care physician, they could be $10 or as low as a $0 copay. Then we go see a specialist. That can be anywhere from $35 to $55. Blood work could be anywhere from $0 to $10. Lab work could be anywhere from $10 to $15. And I said the specialist can be in those ranges. So maybe maximum you're looking at $80 for all those different services, which to me, if you've had this plan in place and you haven't used it and you've been saving up a rainy day fund, you're in a very good spot. And that sums up how the pricing structure and how Medicare Advantage plans work. I hope that you have learned a little nugget of knowledge this week. Take care, and if you have yet to subscribe to my channel, please do. I would appreciate it. And we will see you next time. Thanks so much. Bye.